Thanks everybody for joining us. We're going to go ahead and get started as folks are jumping on. Welcome to this week's session. I am thrilled to be joined this week by Kristeen Coronado. Kristeen is the Chief Operating Officer here at Infinix and brings with her a wealth of billing knowledge and experience. This week, we're going to do something a little bit different, and we're going to focus on a specific specialty, cardiology billing. So Kristeen, let's jump right in. What are the biggest challenges that you're seeing right now in cardiology billing?
So I think the biggest challenges in cardiology billing comes from it being so complex. And we face several challenges with ever-changing clinical policy bulletins and LCDs. And most of our practices, we all have kind of scrubbers, but the scrubbers really mostly focus on Medicare. And so when you're dealing with all the different commercial carriers, they can have different policies. And so it comes down to human beings trying to keep track of all of these different policies. So that's very difficult to do.
I can imagine. What are the most common denials that you're seeing right now in cardiology?
So I'm going to say that pre-authorizations, eligibility, referrals, medical records requests, and then coding in that order. That's typically what we see. Got
it. What tips do you have? Those denials are tough for practices. So what tips do you have for?
It's our billing staff and our front office staff are really overstretched, and with that constant patients checking in, patients checking out, the phones ringing, it's really difficult to get all the authorizations and pre-certifications and referrals that you need to do. So obviously, we have that solution here in Infinix where we can actually come alongside and assist those overstretched personnel. But if you're going to keep it in-house, then it's really important that at the time that the patient's scheduled for the appointment, that the insurance is verified, and that you verify what procedures are going to need pre-authorization, and if there's a referral that's required, and if you're going to end up doing any sort of diagnostic testing with the patient, that you make sure you understand all of the medical necessity involved there. As to the other two denial questions, medical records requests and coding, medical records requests are really, I would say, they've doubled and tripled in the last 2 years. So it's really important that the provider's documentation is basically stands up to medical necessity. So I would say, reviewing those records before you upload them to the insurance carrier to make sure that you're giving them what it is they're really asking for, because it could result in a denial if you actually don't get the proper records in. And coding, I would say making sure, that you're coding all your modifiers, you're not missing modifiers, that you've coded to the highest level of specificity with the diagnoses so that you don't get denials. So that's my tip on that, is just make sure that you've got really good coders and that they understand the specialty that they're working in.
So really good tips. I'm sure right now, especially with all the movement happening in the job market, making sure that you are checking eligibility, benefits before every appointment or procedure, just because
absolutely
that was somebody's coverage last month does not mean that it's still the same coverage. So
that's exactly right. And they don't always notify you when they make those changes. Sometimes we find out from a denial, believe it or not. So you've got to really stay on top of your denials.
Right. And we've all done it, right? You walk into the
Absolutely.
doctor's office and they say, is your insurance the same? Yeah, it is, forgetting the
right.
fact, no, it's actually not.
It's actually
So
not.
yeah, good tips. Good tips. What can cardiology groups do to ensure that they're submitting clean claims and avoiding denials?
So, a really good scrubbing software is really important, but
Mhm.
we all have all of these different systems, from eClinicalWorks to Centricity to Athena to Cario, Epic. And like I said before, the scrubbers that we have really are more attuned to Medicare's guidelines. So it's really important that you understand the correct coding, the correct diagnoses that goes with those treatment codes. Make sure that you're not unbundling, and that you've got all of the correct patient information. That can actually help you keep, get your claims clean. We strive here at Infinix to have a 99% clean claim percentage, and we track that every month. And that's really our goal, is to do that.
Do you have, I told you I wouldn't ask you any questions you didn't know the answer to, but just a quick follow-up. Do you have any preferences on scrubbers? Are there any that you like more than another for cardiology? Given that we don't have any skin in this game at all. So.
Right. I think 3M is probably the Cadillac out there. And obviously you can actually run things through some coding tools to look at your CCI edits. So Encoder Pro, that's an Optum owned, that's a great one. Of course, it's manual, but at least, if you don't know the answer, if you've got, trying to string a bunch of codes together, you can at least manually run it through something like Encoder Pro or Code Correct, or I think there's Code Check, and just a few other things. You can even get on some of the payer websites and put your claim out there to run it through to make sure it's going to get paid. That's kind of like a pre-check, just to make sure. And with the coding rules changing every year, that seems like, EP has gone through a lot of changes this year, where they've bundled together a lot of CPT codes. And so if you don't have that information, you're definitely going to get some denials.
Right. Thanks for answering that. Those were really good ideas. What are your biggest tips for improving a cardiology group's reimbursement? I feel like that's something that keeps every cardiology group up at night, is reimbursement and just staying.
Believe it or not, if you just getting paid for the work that you're performing is so important. So charge capture, just really important to capture all the charges. And really you should be reconciling all of your encounters to make sure that you did capture those charges, because we've seen huge improvements just from capturing the charges, right? But making sure that you're getting all your pre-authorizations, your referrals, making sure that you've verified the patient's insurance every single time, because it could change. Those are really my biggest tips for improving a group's reimbursement, and making sure all the documentation, is correct, and educating the physicians. That's really important that they get educated on what the carriers are expecting, because lots of times they're sometimes the last to know.
Right. And the coder can only code according to the documentation, right? Both have to support each other. So
that's right. So if there's something missing, it's so important to circle back.
Right. Right. So there's been a lot of talk in the news regarding CMS reimbursement changes, authorization changes, a lot of which, due to COVID have kind of stalled a little bit. But as we're coming out of hopefully COVID, I think we'll start to see some movement there.
Mm-hmm.
What should cardiology groups be following closely or concerned about?
I would say that obviously the cuts we got are important, but I think really more important than that is that they understand that digital engagement is essential. It's not optional anymore. And I think that with all of the baby boomers and more people going into the age where they're having to go see cardiology, that you understand what visits can providers do virtually to assist with patient flow, patient care, especially the people that don't really want to get out, right? And come into the office. So what I say to cardiologists is that you can do follow-up appointments virtually for test results. You can do pre-op visits over, virtually. You can do some post-op visits virtually. And any, long-term follow-up, continuing care, and then just regular general follow-up that doesn't require, an EKG or blood pressure check, even, if the patient has a reliable blood pressure cuff, you can even do that virtually. So I think it's really important that cardiology stays in tune with this because it offers more flexible, I think, scheduling. People don't want to miss work.
Right.
And maintaining all those quality outcomes, I think is really important. So if you can get your patients to follow up, that's it virtually. I think it helps you with your no-shows, your cancellations, and your schedule long-term.
For sure. For sure. You and I talked a little bit right before we jumped on about the authorization piece.
Yes, huge.
Yeah. Anything around that folks need to be following, paying attention?
Yeah, I think that there are a couple of carriers out there that tell you that pre-authorization is not required. And the reason it's not required is because it's not a covered service. And I think that you need to pay really close attention to that because, get on their website, build your own internal list if you can, try to keep it carrier specific, and really try to spend focus time looking at your newsletters because sometimes they do tell you. But I would say every year they add things to the list that weren't there last year.
Good advice. Good advice. But you're right. Yeah, it changes constantly.
Yeah.
I always kind of joke and say if there's one thing that is constant in healthcare, it's change.
It's change. That's right.
Yeah, just changes. Everything changes constantly, particularly on the payer side. So
yeah. Yep.
Awesome. Any last parting words of wisdom for cardiology groups that
I guess one of the most complex organs in our body is the heart.
Yeah. And
we want our physicians to be focused on that, very sensitive care, and it's a stressful field to be in. So the more that we can do to take some of that pressure off of them with having to know coding and having to ask the question, did you get a pre-authorization, or how come I have so many denials? I think if they can really focus on their work, then we can actually do our jobs too. So it takes both of us.
Right. Such a good point. You hear physicians complain about that a lot. So yeah, the more we can do to
I
help
would
them.
too. I mean, it's a stressful job, and they're up long hours, and you know, you can't, everybody can't have a good outcome. That's very stressful. And so I think the more we can do as the support staff and maintaining a practice that doesn't receive lots of denials or rejections, and really cover our bases on authorizations, coding, referrals, then they can take care of the patients.
Right. Right. Most of them did not get into medicine to handle claims.
No. And I don't think they get coding classes in medical school.
No, they don't.
Mm-mm.
No.
So.
Well, thank you so much. This was super, super helpful. Lots of really good tips and information for our cardiology folks. Thank you, Kristeen. We hope you'll come back and join us again soon. Have a great evening, everyone. And we look forward to seeing you back here next week. Thanks again, Kristeen.
You're welcome. Thanks, Kate.
Bye-bye, everyone.